Good morning, members of the Senate Committee on Health and Human Services. My name is Mathew Shurka. I'm representing the National Center for Lesbian Rights, a legal organization working to protect the civil and human rights of LGBTQ people. I'm also the co-founder of our Born Perfect campaign, a national campaign representing survivors of conversion therapy across the country, including myself, a survivor of conversion therapy. Thank you for the opportunity to express my support for my support for Minnesota's Senate File 23, protecting minors from the dangerous practice of conversion therapy. Our team has worked to protect LGBTQ youth by supporting legislation such as today's bill, File 23, specifically protecting youth from conversion therapy. Thus far, 20 states and over 120 municipalities have passed such legislation. Each of those laws are receiving bipartisan support. Here in Minnesota, the state, with this passage, will be codifying an already understood issue with extraordinary amounts of evidence that any attempts of conversion therapy is harmful, fraudulent, and may cause lifelong damage and potential suicide. Personally, I am one of 700,000 people living in the United States today that have experienced so-called conversion therapy, as that number is reported by the UCLA Williams Institute. Born Perfect hears from survivors every day who experience conversion therapy. Our data is built off of firsthand experience and accounts tracking therapists in each state. Our data shows that here in Minnesota that there are 109 active conversion therapists. 40 of those individuals are licensed practitioners by the state, and in addition, 40 organizations within the state have been reported to either recommending and or participating in conversion therapy through a referral program with licensed practitioners. My personal experience with conversion therapy aligns with the many harms reported by national mental health medical associations. I was in conversion therapy for 5 years from ages 16 to 21. Each of my therapists was a licensed professional. In meeting with a licensed therapist, my father was told that being gay was a mental illness, that same-sex attraction can be cured, and that all people are innately heterosexual. My first treatment required that I did not speak to my mother and 2 sisters, which lasted 3 years. I was told this would ensure I would not pick up any effeminate behaviors or see girls or women as my peers, but to learn that men are my peers. While I truly believed conversion therapy was working, I became depressed and suicidal in year 2 of that time in therapy. May I finish this? It's not much longer. Or I can end.
If you could just wrap up your thoughts, please.
Sure. I just wanted to add that I was also subjected to the use of Viagra, engaging in sexual activity when I didn't have erectile dysfunction as a healthy young 17-year-old man. To speak to the cost, my parents spent $30,000 in the 5 years of my conversion therapy. I'm going to hand out these testimonies and reports. One of them specifically is 25 former therapists who no longer do conversion therapy are in support of the passage of File 23. And it's a really powerful document to have former conversion therapists oppose doing conversion therapy and supporting such legislation in survivors. Thank you.